Tonight at the meeting, we have the great pleasure of Dr. Stone is going to speak with us about health care for the uninsured. He is one of the founding members of Hoosiers for Common Sense Health Plan.
You got it.
And an emergency room doctor, and he has a lot of great things to say. So please give a round of applause to Dr. Stone.
Thanks. You know, I never went to school at IU, but I am a native Hoosier, and I grew up in Evansville, and I've been here in Bloomington for the last 23 years. You're an Evansville person? All right, good. So I've worked in the ER for the last 23 years, and then for the last couple of years I've been the medical director of the CHAP Clinic, Community Health Access Program, and I think some Timmy folks are going to volunteer at CHAP, right? So that'll be fabulous. That'll be good. You what? You're from Evansville. All right. All right. Good for you. So I went to Harrison High. If that matters. All right. Okay. And of course, I probably graduated before you were born in 1970s when I graduated. But anyway, so let me just ask a couple questions. How many people in the room have what they think is pretty adequate health insurance? Let me see your hands. Okay. So how many does that leave who either have no insurance or they think their insurance is pretty shaky? Okay, so there's a few of you, and you know, college students in general have pretty good health, and oftentimes do have some kind of coverage, often through their parents, and so you know, I sometimes ask myself, why is it that a couple of years ago, on top of everything else I was doing, that I got interested in such an exciting topic as health insurance? But I am. And so I'm going to tell you what I know. So I'll start by telling you a story. This is a story that happened to me, not this last summer, but the summer before, summer 2005. And it was an afternoon, kind of a typical afternoon in the emergency room. And the nurses wheeled in a fella who was probably about 57 years old or so, and he was kind of clutching his chest, and he was pale and sweaty and breathing hard, and I mean, he just looked awful. And as soon as I looked at him, I thought, you know, this guy looks like he's having a heart attack. So they got him up on the gurney, and they're sticking him for IVs and putting oxygen on him and starting to monitor, and I'm starting to try to get a little bit of history on him. And get this out of the way here, and so I don't fall, which would be embarrassing. And so while this stuff is going on, there are people, you know, crowding around, and it's, you know, it's just like on the TV show ER. You know, things are moving because this guy's really sick. And I say, so when did your chest pain start? And he says, oh, it started about 2 hours ago. And where do you feel it? What's it feel like? And he says, Doc, I got to tell you though, you know, this chest pain today is not as bad as the pain I had 2 nights ago. I said, what happened 2 nights ago? He said, oh man, it was horrible 2 nights ago. It was like an elephant sitting on my chest. I could hardly breathe. The sweat was pouring off of me. Well, why didn't you come to the hospital 2 nights ago? Well, I don't have insurance, and I was afraid of the bill. So what had happened was this guy had had a heart attack at home 2 nights before, and he somehow managed to survive it. And then now, when he's starting to have his second heart attack, he's feeling terrible, and by this time he's too weak to fight it. So his family brought him on in. And it turns out that he had lost his job a couple years before, and then he lost his insurance, of course, and then he had not had enough money to pay for his diabetic pills and his blood pressure pills. You know, medicine that maybe would have cost $3 or $4 a day, and he stopped taking it, and so he has a heart attack. So we rushed him up to the cardiac catheterization laboratory, and they did all the high-tech stuff, and they put a catheter into his heart and injected dye, and they found the narrow spot, and they put a stent in it, and they opened it up, and they essentially stopped the second heart attack and saved him at that point. But while they were there, as they were taking pictures, x-rays of the heart, they could see that part of his heart wall, part of his heart muscle was just dead. And nothing at this point. We don't have anything high-tech enough to have saved that part of his heart muscle. So part of his heart muscle just died in the first heart attack, not enough to kill him. He survived it, but we stopped the second one with all the high-tech stuff. So he went home after 2 nights in the hospital, and I called him up about 6 months later, because I've been thinking about this guy, because it just seemed to symbolize so much of what's wrong with our healthcare system. And so I looked up his bill first. I looked him up in the computer, looked up his bill. Anybody want to guess what his bill was for 2 nights in the hospital and about 2 hours in the cardiac catheterization lab?
4,000.
How much?
6,000,
6,000,
7,000.
12.
Then now you got $40,000. $40,000. And that was just his hospital bill. That's what I could look up. I don't know what his doctor bills were, which probably added a few thousand more. But that was just his hospital bill was almost an even $40,000. So I called him up, and he was really glad to hear from me. And I said, "How are you doing?" He was really upbeat. He said, "I'm doing great." He said, I'm taking my medicine, I'm going to the doctor, I'm trying to get my strength back, I'm not, I get short-winded, and, he was actually going to be having some surgery on a hernia coming up in a couple weeks. And I said, "Well, you were so worried about your bill when you came in, how'd that all work out?" And here's the weird, happy ending to this story. Well, it turns out that because he'd stayed home with the first heart attack, and had permanent heart damage, while he was in the hospital, he qualified for Medicaid because he's disabled. So his bill got taken care of only because he'd stayed home with the first heart attack, and now he's disabled. So what a weird way. So now this guy, he's finally, now he's going to have his hernia surgery because he's on Medicaid and he's covered. But what a terrible system we have that makes it, this is the only way people can get stuff done.